Good evening guys. In this lecture we will be discussing mandibular movements. What is the significance of mandibular movements? Well, they are being studied for designing, selection and adjustment of the articulated developing tooth form for dental restorations, for understanding the basic principles of occlusion, for diagnosis and treatment of TMJ disturbances, for preserving periodontal health and for the arrangement of artificial teeth. What are the determinants of mandibular movements? Condylar guidance, incisal guidance and neuromuscular factors. So let's see what is condylar guidance. According to the glossary of prosthodontic terms, mandibular guidance generated by the condyle and articular disc traversing the contour of the glenoid fossa. The slope of glenoid fossa is S-shaped, can be measured with a protrusive interocclusal record. So protrusive interocclusal record is used for recording condylar guidance. Then comes incisal guidance. The influence of the contacting surfaces of the mandibular and maxillary anterior teeth during the mandibular movements, that is the definition of incisal guidance as given by the glossary of prosthodontic terms. The slopes of the lingual surfaces of maxillary anterior teeth, they guide the mandible during protrusive movement. Then comes neuromuscular factors. The muscles of mastication and tone of these muscles. According to Sherry, the classification of mandibular movements are as under. Based on the axis of movement, rotation around the transverse or hinge axis, sagittal axis and vertical axis. Then based on the direction of movement, opening movements, closing movements, protrusive movements and lateral movements. Then comes based on the extent of movement, the border movements and intra-border movements. And based on habitual movements like speech, mastication, deglutition and respiration. CNS controlled. The innate movements are in breathing and swallowing, whereas the learned movements are chewing and speech, and then comes non-functional movements, that is bruxism. Classification of mandibular movements according to Occlusal. Number 1, based on type of movement within the TMJ, rotational or translational movement. And then based on the plane of border movement in horizontal or in frontal or in sagittal plane, there are 3 planes in which border movements occur: X plane, Y plane and Z plane. Rotational movements. A process of turning around an axis. Mouth opens and closes around a fixed point axis within the condyle. Occurs in inferior joint cavity. Again, I am emphasizing on this fact that TMJ has 2 components, the superior component and the inferior component. And the opening and closing movement, it occurs, or the rotational movement, it occurs in the inferior component. The axis of rotation can be described in 3 planes: the horizontal, frontal and sagittal axis. Horizontal axis of rotation. It is also called as hinge axis, the opening and closing motion, the hinge movement. And this hinge axis, it passes through the condyles, both the condyles. Then comes frontal or vertical axis of rotation. Condyle moves anteriorly of terminal hinge axis position with vertical axis of opposite condyle remaining in terminal hinge position. This type of isolated movement does not occur naturally, that one condyle will be staying at the place and one is just rotating. No, that is not possible. Then comes sagittal axis of rotation, condyle moves inferiorly when other remains in terminal hinge position. This is remaining in the terminal hinge position and one is moving inferiorly. Ligaments and musculature of TMJ, they prevent inferior displacement of condyles, so this type of isolated movement does not occur naturally but occurs only and only in terms of dislocation. Translational movements. Translation, all the objects, they move simultaneously with same velocity and direction. Teeth, condyles and rami, they move in the same direction, occurs when mandible moves forward. Occur in superior joint cavity during most normal movements of mandible, both rotation and translation, they occurs simultaneously. So now we know that the translational movement, it occurs in the superior compartment or superior component or superior cavity, whereas rotation occurs in the inferior cavity. Border movements. Mandibular movement at the limits dictated by the anatomic structures as viewed in a given plane according to the glossary of prosthodontic terms. Border movements are limited by ligaments and the articular space of TMJ as well as morphology and alignment of the teeth. Border movements. They are recorded with a pantograph. The border and functional movements of the mandible are in single plane border movement, sagittal plane border and the functional movement. We know this, the envelope of motion, and then the horizontal plane border and functional movement, the Gothic arch which we trace, and the frontal vertical plane border and functional movements, this shield type of movement. And if we see it in 3 dimension, then a whole envelope of motion which was described by Posselt or also known as Posselt's envelope, it is over here. Border movements, the sagittal plane border functional movements. Sagittal plane, 4 distinct components. The posterior opening, it has 2 stages. The anterior opening limited primarily by the ligaments and morphology of the TMJ. Superior contact determined by the occlusal and incisal surfaces of the teeth. Here it may have a shift from centric relation to centric occlusion. Functional, not determined by an outer range of motion but by the conditional responses of the neuromuscular system. Border movements, we are discussing posterior opening border movement, and we know that it has 2 stages. In the first stage, the condyles are stabilized at terminal hinge position. In centric relation position, the mandible can be rotated around the horizontal axis to a distance of only 20 to 25 millimeter. At this point, the ligaments, they tighten, after which the continued opening results in anterior translation of the condyle. Then stage 2 opening starts, and that is beyond 20 to 25 millimeter. Condyles, they start to translate over here. Condyles, they start to translate. Location of the axis of rotation shifts to the rami. And condyles, they start moving anteriorly and inferiorly, and the anterior portion of mandible is moving posteriorly and inferiorly. We can see that the condyle, they have moved forward and mandible is rotating posteriorly and inferiorly. Maximum opening is almost 40 to 60 millimeter. Beyond that, the capsular ligament does not let further opening. Anterior opening border movement. After maximum opening, closure is accompanied by contraction of inferior lateral pterygoids. It is not a pure hinge movement because it produces eccentricity in the anterior border movement. The maximum protrusive position is determined by stylomandibular ligament. Superior contact position. It is mostly with a shift from centric relation to centric occlusion. Its delineation depends on 5 factors: amount of variation between centric relation and maximum intercuspation, the steepness of the cuspal inclines of the posterior teeth, lingual morphology of maxillary anterior teeth, amount of vertical and horizontal overlap of the anterior teeth, and general interarch relationships of teeth. Superior contact border movements in centric relation position. In initial tooth contact in terminal hinge closure, that is centric relation, occurs between the mesial inclines of a maxillary tooth and the distal inclines of a mandibular tooth. If muscular force is applied to the mandible, a superior anterior movement will result until the intercuspal position is reached. This may have a lateral component. This shift from centric relation to intercuspal position, or that slide, is present in almost 90% of the population, and average distance it covers is 1 to 1.25 millimeter, like this. Now, superior contact border movement. In intercuspal position, the opposing anterior teeth usually contact. When the mandible is protruded, contact between the incisal edges of the mandibular anterior teeth and the lingual inclines of the maxillary anterior teeth results in an antero-inferior movement of the mandible. This continues until the maxillary and mandibular anterior teeth are in an edge-to-edge relationship, at which time a horizontal pathway is followed, like this. Superior contact border movements. The horizontal movement continues until the incisal edges of the mandibular teeth pass beyond the incisal edges of the maxillary teeth. Mandible moves in a superior direction until the posterior teeth they contact. The occlusal surfaces of posterior teeth then dictate the remaining pathway to the maximum protrusive movement, like this. Maximum protrusive movement. Then comes functional movement, the fourth one. All normal, proper or characteristic movements of the mandible made during speech, mastication, yawning, swallowing, etc., they occur during functional activity of the mandible. Usually they occur within border movements, therefore considered free movements. Require maximum intercuspation and therefore typically begin at and below the intercuspal position. Below the intercuspal position. Postural effects on functional movements. When head is positioned erect, straight, the person is sitting very straight, the postural position of mandible is 2 to 4 millimeter below the intercuspal position, like this. This is the intercuspal position. So 2 to 4 millimeter below the intercuspal position. The face is directed 45 degrees upward, as during drinking there will be retruded position of the mandible and elevator muscles, they will contract, posterior path of closure will be there, tooth contact posterior to intercuspal position. It is an unstable position and mandible will slide to the maximum intercuspation, like this here at 45 degrees upward when person is drinking water or something. If face is directed 30 degrees downward, as during eating, anterior shift of mandible will be there. The elevator muscles, they will contract and path of closure will be slightly anterior. Teeth will come in contact and in anterior to the maximum intercuspation position, like this over here. This is the maximum intercuspation position. Teeth will come in contact anterior to it. This is the position for, this is how we see it. So this is the position for eating. Now comes horizontal plane, border and functional movements. Horizontal plane border movements, traditionally the Gothic arch tracer is used. If you remember, you were doing it for making the Gothic arch tracings in your complete denture cases. Traditionally, Gothic arch tracer is used for this purpose, so components will be left lateral border, then continued left lateral border with protrusion, left lateral border with protrusion, then right lateral border and right lateral border with protrusion. Here we can see left lateral border movement. This is the working side, it is the rotating condyle, this is non-working orbiting condyle. So what will happen? Left inferior lateral pterygoid, it stays relaxed. The left condyle will remain situated in the centric relation here. Right is translating, orbiting. The result will be a left lateral border movement. Then continued left lateral border movement with the mandible in the left lateral border position, contraction of the left inferior lateral pterygoid along with continued contraction of the right inferior lateral pterygoid. It will cause left condyle to move anteriorly to the right side. It causes a shift in the mandibular midline back to coincide with the midline of the face. Right lateral border movements. Mandible comes back to the centric relation, left condyle orbiting condyle as it is orbiting around the frontal axis of the right condyle. Right condyle rotating condyle, it because the mandible is now rotating around it. So it will become now rotating condyle. This is the working side now and this is the non-working or orbiting condyle. So this previously it was here, now this is the right lateral border movement. And then continued right lateral border movement with the mandible in the right lateral border position, contraction of both the right and left inferior lateral pterygoid will cause the right condyle to move anteriorly and to the left. Border movements in horizontal plane we are discussing. Lateral movements can be generated by varying levels of mandibular opening, and with each increasing degree of opening the tracing will become smaller. They are closed, the upper and lower jaws are closed, and as the mandible is opening the size of the tracing will become smaller. This functional movement in horizontal plane, it occurs near the intercuspal position. This is the intercuspal position, the centric relation position. During chewing, the range of jaw movement begins some distance from the maximum intercuspal position, but as the food is broken down into smaller particle sizes, jaw action moves closer and closer to the intercuspal position. So this is the end-to-end position where you incise. The incisors are in edge-to-edge position, and then early chewing or early mastication area, then the late or later mastication area, which is now closer to the intercuspal position. Frontal view, it is just like a shield, as I have already told you. The frontal border movement, if we trace, they will be in the shape of a shield. Frontal plane border movements, a shield-shaped pattern can be seen that has a functional component and 4 distinct movement components. So these are the 4 distinct movement components, and there will be a functional component as well. The left lateral superior border movement. With the mandible in the maximum intercuspation, a lateral movement is made to the left. it is inferiorly concave. Then left lateral opening border, laterally convex path, it is slightly left convex. As maximum opening is approached, ligaments they tighten and produce a medially directed movement that causes a shift in the mandibular midline to coincide with the midline of the face. Then comes right lateral superior border movement, similar to the left lateral superior border movement. It will also be inferiorly concave. And then the right lateral opening border, it is similar to the left lateral opening border movement. It will be slightly convex. The functional component of the frontal plane. It begins and ends at the intercuspal position. During chewing, mandible drops directly inferiorly until desired opening is achieved. It then shifts to the side on which the bolus is placed and rises up. In maximum intercuspation, the bolus is broken down between the opposing teeth. In the final millimeter of closure, the mandible quickly shifts back to the intercuspal position. This is the three-dimensional envelope of motion which was described by Dr. Posselt and also known as Posselt's envelope of motion. It represents combination of the border movements in all the three planes, the sagittal, horizontal and frontal. All movements happen within the envelope of motion. It is controlled by the neuromuscular system to avoid injury to any of the oral structures. So this is the summary of all these movements which we have discussed, and the sagittal plane, the horizontal plane and the frontal, and different types of movements which occur, and then the three-dimensional envelope of motion. So over here we are done with our second lecture of the day, and see you soon with another interesting lecture. I tried my level best to make these movements of mandible as much elaborated as possible. So hopefully things will be clear to you now. Thank you very much.